Hi, I'm Dr. Seth Deja from Pediatric Dental Specialist of Lafayette. I'm a pediatric dentist. One of my favorite things about it is taking care of the younger patients and also taking care of those patients who have special health care needs. It's just a challenge that I have really enjoyed. I think that we've been very successful at it. And, in all the aspects of dentistry, it's just what I wanted to devote my career to. Um, I like showing people that the appointments, if we take the time and explain things, that, really almost anyone can come in and have an appointment that they're happy with and that they feel like is a success. Tooth decay is very common. We have patients come in all the time, whether it's from, very minimal spots or minimal decay to very deep decay. There's multiple factors that influence it. It can come from environmental factors such as what we're doing at home, our oral hygiene regimen, the types of foods that we're having, or the drinks that we're having, and the frequency that we're having those items, as well as just our biologic factors. So whether, some people are more susceptible to having cavities. So if you're having any of these issues, come into our office and we can discuss what options are appropriate for you. So if you're a parent and you notice a spot in your child's mouth that you think that might be decay, one of the best things to do would be come into the office so that we can have a look. We'll do a clinical exam as well as take any x-rays if they're needed. We can talk you through the process of whether or not that whatever you're seeing is actually a cavity and whether or not it actually needs to be treated. This could depend on, where the cavity is, whether it's stain or even a cavity, and the patient's age. Oftentimes we can monitor areas that, really would be treated if the patient was younger. But at a later age, one of the best options is to allow that tooth to fall out on its own. Parents should take their children to the dentist early because dental decay on baby teeth often does need treatment. If left untouched or untreated, it can lead to things like pain or infection, or even worse, if a tooth is lost earlier than it should be due to deep decay, the patient may not have enough room in the future for their permanent teeth to come in. And this can lead to braces when we may not have needed them, or even the extraction of healthy permanent teeth. One of my favorite parts about pediatric dentistry is showing families and kids that getting a cavity fix can be a comfortable and positive experience. It all starts with the environment. Whenever you come in, we usually have a movie playing. We offer the parents coffee. In the treatment room, we have headphones, a TV up above playing the patient's favorite show, as well as weighted blankets. And we also encourage loved ones, family members to be back there so that the patients, feel comfortable with their family members while they get their treatment completed. One of the biggest misconceptions is that all cavities have to be fixed with some type of drill or a shot. Well, really the first thing we want to do is establish an excellent oral hygiene regimen and nutrition regimen for the patient. After that, with those things going on at home, we have different medicaments we can place as well as conservative measures so that we can often treat a cavity or not treat a cavity and allow the tooth to just fall out depending on the patient's age. Some of the things we discuss with families whenever they ask us how to prevent future tooth decay, outside of your regular brushing morning and night and flossing, is to really watch the frequency of snacks, even if they seem healthy, and also the consumption of drinks that have sugar in them, whether it's Coke or Dr. Pepper, or even things that we give at sporting events like Gatorade or Powerade. All those things in combination can just create an environment that makes the mouth more susceptible to developing dental decay. If a parent has concerns about their child's teeth, one of the best things to do is schedule a visit so that the child can come in and we can do an exam and take any x-rays that are necessary. So the best option is to give our office a call or even go online to schedule. Tell us what's going on and all of your concerns, and then come in and we can discuss them together. We can take x-rays, we can take pictures in the mouth and explain them, the findings to both you and your child.